Hello everyone, welcome back. If you're interested in pediatric dentistry, this is definitely the video for you. So many months ago, I went on a Boston trip with my friend Tehzeen, and she's now a pediatric dentist. Well, on that trip, I asked her some questions, some interview type questions that may help you if you're interested in pediatric dentistry. Now in the video, you'll see that I kind of start off not from the beginning, and that's because I lost some of the footage, but I still wanted to get something together for you guys, and I still think it will be helpful. So I hope you guys enjoy the video, and if you have more questions about pediatric dentistry, make sure to go follow her on Instagram at MiniTeethDoc, and you can send her a DM there. All right, enjoy. Tehzeen, the next question that I'm going to ask you is, why did you choose to be a pediatric dentist? Like, what got you into pediatric dentistry? How did you decide on that specialty?
A little biased again because both my mom and sister are both pediatric dentists, but when it came down to actually applying and seeing if this is the right specialty for me, I had to reflect on everything because, you know, it's easy to just go do what everyone else is doing in my family because that just seems to be the path for me. But when it came down to it, I just love kids. They make my day, and it's so nice to just see them grow and smile, and then they just say the funniest things as well. And now that I'm in residency and I have been working with them, it just all clicked because when they just come and hug you and are excited to see you, especially after you build that rapport with them, after a couple of visits, it's really special. And not only are you like helping them with their oral care, but you're making it a positive environment for them in terms of the future too, to take care of their not only oral health but overall well-being. So I feel like you could really make an impact in these kids' lives, and they're just adorable.
Yeah, and it keeps you young too. Like all the trendy things.
Exactly.
You know what's in and what's not in.
I was told skinny jeans are not in, so FYI, no skinny jeans, guys.
Not now, yeah.
No more.
Did you ever consider a different specialty, or did you ever consider just doing general dentistry?
I do like general dentistry because of the variety. However, I did kind of have a knack for ortho. I just loved learning about it, and I thought it was really cool. And one thing with pediatrics is you can also do a little bit of ortho. So I do like the variety that peds will give me too, but ortho is the only one that I really saw myself going into other than peds. And you do a good amount of ortho in your residency. Like, you make your own appliances. Yeah.
Does that make you like ortho more or less?
So at first, when we had our ortho days, I hated them just because I'm not very educated with it. You know, my specialty is peds, so everything's oriented towards peds. But after a couple months of doing ortho days, I love it more and more. Making space maintainers and appliances to help you regain space. So we're helping correct kids' skeletal and dental manifestations while they're growing. So to prevent the need for long-term braces in the future.
All right, guys, we're in a new spot.
We're in Back Bay. It's a big touristy area, lots of shops. We're currently on Newberry Street where we have our Levain cookies.
Tell us a little bit about applying to pediatric residency. What do you think like really made you stand out? You had to have known early that you wanted to do peds residency because you had to work super hard like in the beginning. What advice do you have for someone who's interested in getting into peds residency? What can they do to make themselves a good applicant to get into a good school?
So yes, I did know I wanted to do peds since I was probably in middle school. But things I would recommend, definitely grades. Grades are always important. I mean, that's not everything, but grades are important in any application. Another thing that helps you stand out is peds extracurriculars. So I was participating in, our peds study club meetings, and something I did was the American Academy of Developmental Medicine and Dentistry. So this was an organization that your school may have, may not, but it's an organization that helps advocate for patients with special needs, both medically and dentally. So I worked a lot with them, which was, I think, very helpful for my application. I also did a tiny bit of research. Probably should have done more, but I mean, you gotta do what works for you.
Did you do research in undergrad and dental school, or just dental school, or just undergrad?
Just dental school. It was very, very minor.
Research is really important though.
It is.
I think that's really good advice.
I think, I'm very happy with my application, and I think I was pretty well-rounded overall. But if there were something that I would change, it would probably be to add more research. And I know it's very tough in dental school, but try to get on that super early in first year. Reach out to postdoc residents if you have them in your school and see if you can participate in their project.
Did you do a lot of peds shadowing at your dental school?
I was blessed to have my sister in the PEDS residency program in my dental school. So I did shadow quite a few times. I went into the OR and I went to their clinic. So yes, that was very helpful. Also to see if it's a specialty you want to do. So definitely, you know, our school didn't give us an extreme amount of PEDS exposure. So if you are interested in any specialty, I recommend definitely shadowing because you don't want to dive into something where you're not certain about it.
What about amount of schools? Do you know like what's the usual amount of schools someone should be applying to?
I think it'll all depend on you, where you want to go. So for PEDS, of course, we have stipend-based programs and we have tuition-based programs. And they're very different in the emphasis on didactic or clinical experience. So it's going to depend on you, where you want to go, and also how strong you believe your application is. For me, I wanted to do PEDS no matter what, but ideally I wanted to do a stipend school that emphasized both didactic and clinical experience. And I wanted to stay in the Northeast for the most part, so I don't know, I think I applied to maybe 8 schools.
Is that pretty normal, do you think, or is that
I heard people that did more, people that did less, but also the people that did less were very certain with the specific schools they wanted to go to, or they didn't care too much if they matched. But I definitely wanted to do PEDS no matter what. So that was a good number for me, but I do know people that did some more, some less. It really depends on you, your application, and where you want to go. The fit is really important. You don't want to be somewhere where you're not going to like it. So definitely pay attention to that aspect and different components of the program.
Yeah. Okay, great. Thanks.
Of course.
All right.
We're
back again in a new location. Where are we, Tay?
We are by the Charles River.
For your next question, how would you compare dental school to residency? And which one did you like more and why? Because they're different. One was 4 years, one is 2 years.
I thoroughly loved my entire dental school experience in Boston. My personal life and dental school life was just amazing. I loved all my friends. I loved the city I was in. Of course, it was very tough and hectic at times with the amount of exams and work we had to do, but that's something I enjoy. I love studying, so that was a really fun time for me. Even getting requirements done, it was a grind and it was very stressful at times, but I loved it. I loved it all, and I think I got a very good education at Boston University. Residency as well. The quantity of patients we see in pediatrics in Rochester is it's insane. So the amount of experience I'm getting there is amazing, and we're able to help a lot of kids, which is wonderful. It does get a little bit hectic just because we are doing so much, and it's overwhelming to see the amount of kids that come in with all these cavities. Pretty sad at times to provide emergent treatment for these kids in need, but generally I do like my experience. I've said this before, I'm not the biggest fan of Rochester compared to Boston, but I'm really happy with my residency experience and education.
How does it feel being back in Boston, knowing that you loved it so much and you're back here?
I think I might be moving back soon. I love it so much, and it's just bringing up all these memories, and this city is so great.
Was residency what you expected it to be? Like the amount of work and the amount of patients? Like, were you mentally prepared for what it turned out to be?
I definitely was prepared. In our interviews, talking to the second-year residents, they told us that it's going to be tough. It's going to be a lot of patients, but by the end of the residency, you're going to feel so equipped to go wherever with the amount of patients you see, amount of procedures you do. And so I was prepared that it would be a lot, and it is a lot and has been, especially in first year when you're on call as well. But I am someone that thrives under pressure and stress and just seeing multiple patients, and I feel like, you know, you hate it when you're in it, but in hindsight, you're so thankful for it, because the experience I got there was just amazing with the amount of patients and procedures we are doing.
What's your favorite procedure?
Ooh, I like doing fillings, composite. Crowns are fun and easy compared to, you know, your adult crowns that are so technique sensitive with so much precision. So baby crowns are, you just do a couple swipes, stick a crown on. But I like as you said, I like art, and so the sculpting of composites will always be one of my favorite things to do. In Eastman, we also get experience doing pulpectomies and root canals, so that's been a nice thing to learn while we're in residency, because a lot of pediatric dentists don't do root canals. Yeah.
Okay, those are great answers. Thank you.